In this video, I will talk about the most important things you need to buy before the baby is born. It can get overwhelming, and I'm here to tell you the basics and the must not forget things to include in your list. Hello, moms and dads. This is Nurse Cherry, and welcome to Mother Baby Central. This is a place you need for great information on how to take care of moms during pregnancy and postpartum, and babies during newborn stage and first year of life. There is a lot of preparation to do before the baby's arrival, but one of the most exciting things to do is shopping for your little one. Most new parents think babies need a lot of stuff. Well, that's true in some ways, but I'm thinking more of the quantity of a specific baby item, like diaper, wipes, and formula if formula fed. Diaper changes are endless until the baby is potty trained, so please allow me to guide you in this area. Here are the recommended 6 must-have baby products to buy before your baby arrives. Number 1, crib. You need a place for the baby to sleep, so that should be number 1 on your list. Important thing to note about cribs is that they need to have a firm mattress. If you can afford to buy only one, then get the crib that attaches to an adult bed. Sometimes they are called co-sleeper. Let me make myself clear. This crib is a standalone crib that can be attached to mom's and dad's bed. This promotes the Safe Sleep initiative where babies sleep in their own bed, face up to the ceiling in a flat position without any clutter around the bed. You should never be sleeping in the same bed with your baby to avoid the risk of sudden infant death syndrome. I want to emphasize the recommendation of the CDC about sharing a room with your baby. Ideally, it is encouraged for the baby definitely to sleep in their own crib, but in the parent's room called room sharing. This means that you will place the baby's crib or bassinet in the parent's room, ideally for the first 6 months. This intervention supports the promotion of breastfeeding and baby safety. It makes this process easier by having easy access to the sleeping area for the baby that is conveniently placed next to the bed. So, when the mom gets really tired and starts to fall asleep after nursing, she can easily place the baby on the crib next to her without getting up from her own bed. 2 important criteria for cribs: firm and flat. Avoid elevating the head of the bassinet or the crib if you have the option to. Why? Because when you incline the head of the bassinet, the baby can slide down to the bottom of the crib, causing the baby to be in an upward position. This position can potentially block the windpipe, resulting in the baby's inability to breathe. What other things can happen? Well, the baby can end up in a side-lying position or on the belly, which is also a risk factor for SIDS or sudden infant death syndrome. Sleeping on the back, face up, is one of the most remarkable interventions during the 1990s that made a significant decline in the incidence of sudden infant death syndrome. Number 2, cotton or muslin swaddling blanket and a sleeping sack. The best material to swaddle a baby is cotton or muslin because they are thin, breathable, and easy to use. So just in case it gets loose, there is no risk for suffocation compared to using thick blankets. Initially, babies want to be swaddled because it gives them security and comfort. But once they get bigger, they don't want to be in a tight space anymore. They wanted to explore. They are getting more mobile as they get older. At this point, to keep the baby nice and warm, use a sleeping sack or like a sleeping overall pajamas. Let's talk about statistics for a moment before we proceed. I'd like to share this information not to scare anyone, but to educate everyone on what the data says regarding deaths caused by sudden unexpected infant death, or SUIDS. 90% of babies die during the first 6 months of life, 72% between 1 to 4 months, and most of the deaths occur at 2 and 3 months. Now, this data represents different causes of the deaths before the baby turns a year old. This can be due to unknown reasons or accidental strangulation and also suffocation. Therefore, we have to eliminate the things we can control to keep the baby safe. There are identified risk factors for sudden unexpected infant death or SUID, and these are prenatal smoking, low socioeconomic status, prematurity, low birth weight, and prior admission to neonatal ICU. By the way, if you stick with me until the end, I will share a bonus tip on what not to buy for your little one. So hang tight and let's move on. Number 3, we already have the crib on top of our list. Therefore, we need something to cover the mattress. So let's include that in our list. A fitted crib sheet. Make sure you get the correct size so the sheet will not get loose and can be potentially a hazard to the baby. Number 4, diapers. And these does not have to be disposable diapers. It can be made of cloth, which some parents prefer, whatever you decide to use for your baby. And you need lots of them. When buying disposable diapers, don't buy a ton of one size because babies grow fast and you might end up with small diapers that cannot fit eventually. Pro tip, only include a small amount of a specific diaper size in your baby registry. Number 5, baby clothes like onesies, baby shirts, and pants. Most of the time, babies stay in the house anyway, except for the regular doctor's visits. I know you can't resist buying those cute outfits, and you surely can, but don't overdo it. Buy more of the basic clothing like the onesies, the shirts, the pajamas, or cotton pants. The same concept goes with the clothes. Don't buy tons of newborn sizes. During the first year of life, babies grow and have growth spurts at different times. So play it by ear and shop as needed. Number 6, car seat. If there is one thing you really need to get on your list, it's this one. Did you know that car seats have expiration dates? Yes, they do. So beware of using a hand-me-down car seat. First, it might be expired, and second, the safety feature is probably not up to the standard. The straps could potentially be less sturdy compared to when it was brand new, and the buckles might give out. There is no guarantee that your baby will be protected if you get into a car accident. If the budget is a little tight, include it in your baby registry. Maybe family and friends can pitch in for a new car seat. Remember, your baby's safety is a priority. And here is a bonus tip, opposite of what we just talked about. Here is a list of what not to buy. Number 1, fluffy, thick blankets. During the cold months, I see some parents bring thick, fluffy blankets to the hospital. This is a huge no-no. Never use a thick blanket to cover or swaddle your infant. Fluffy blankets put babies at risk for suffocation. Review the recommended list. There are other things you can use to keep your baby warm, like a hat, a sleeper sack, overall PJs, and sensible layering. Number 2, pillows. Another thumbs down for the do not buy list. Babies should not be using any at all. Remember, babies should be sleeping flat, no pillow behind their heads or whatsoever to minimize the incidence of suffocation. Now, the rest of the list belongs to the category of soft, plush, and loose. All of these can cause strangulation and suffocation, and also they're not recommended per the American Academy of Pediatrics and CDC. Number 3, stuffed animals. Babies cannot play with stuffed toys yet anyway, especially when they are newborn. So there's no business of that stuffed toy in the crib with the baby. Maybe later when they are a little older, when they're like sitting and walking or something like that. Some parts of the stuffed toys can fall off and can be a potential choking hazard, like for example, the beads the manufacturer used for the eyes. Number 4, little gadgets used to position the baby, like the ones you see in the store to put around the head or the body so babies can be placed in a certain position. Or products for sleeping so you can co-sleep in the same bed, and bumper pads, which are not allowed anymore. And there you go, parents! The recommended infant supplies you must buy before the baby arrives. If you find value in our video for today, please click the like button and share it with your family and friends who you think needs this kind of great information. As always, be well everyone, make this day count, and happy watching!